Hi there, welcome back to our channel. Today we are going to talk about high blood pressure. So if you're new here, please consider subscribing to get notified when we publish new videos. Let's start. Blood pressure is the force of blood pushing against the inside walls of arteries. Arteries are small tubes that carry oxygen-rich blood away from your heart to all parts of your body. Blood pressure is represented by two numbers in a reading. The top number represents the pressure in your arteries when your heart beats and pumps out blood. This is called systolic pressure. The bottom number is the pressure in your arteries when your heart is at rest between beats. This is called diastolic pressure. When you have high blood pressure, it means that your blood is pushing harder than normal against the walls of your arteries. Over time, this extra pressure can damage your arteries and organs, making them less efficient at doing their jobs. It can also increase your risk of developing serious health conditions such as heart disease, stroke, and kidney disease. High blood pressure is also known as hypertension. Hypertension can be dangerous because it often doesn't cause any noticeable symptoms, which means that many people with high blood pressure don't know they're at risk for serious complications until damage has already been done. That's why it's important to have your blood pressure checked regularly, especially if you are at risk for high blood pressure. So what are some common causes of hypertension? One of the most common causes of hypertension is having a chronic medical condition, such as diabetes or kidney disease. Other causes include being overweight, eating a diet high in salt or saturated fat, lack of physical activity, stress, and age. As we get older, our blood vessels become less elastic, which makes it harder for our hearts to pump blood through them. This can lead to a rise in blood pressure as we age. Genetics also plays a role in blood pressure. If you have a family history of hypertension, you may be at increased risk of developing the condition yourself. It's also important to note that sometimes high blood pressure can be caused by temporary factors such as dehydration, not getting enough sleep, or taking certain medications. So it's important to talk to your doctor to rule out any underlying medical conditions. Hypertension can cause damage to many parts of the body, including the eyes, brain, heart, blood vessels, kidneys, and reproductive organs. It can also cause general body pain and discomfort. Here are some specific complications that can occur as a result of hypertension. First is heart disease. Over time, high blood pressure can make the walls of your arteries stiff and less elastic. This can make it harder for your heart to pump blood through your arteries, which can lead to heart disease. Second is stroke. High blood pressure can also damage the blood vessels in your brain, which can lead to a stroke. A stroke occurs when the blood flow to a part of your brain is interrupted, which can cause brain damage. Third is kidney disease. Your kidneys are responsible for filtering waste and excess fluid from your blood. High blood pressure can damage the blood vessels in your kidneys, which can make it harder for them to do their job. This can lead to kidney disease or kidney failure. Fourth is vision loss. High blood pressure can also damage the blood vessels in your eyes, which can lead to vision loss. Fifth is erectile dysfunction. In men, high blood pressure can also affect the blood flow to the penis, which can lead to erectile dysfunction. And last is cognitive decline. High blood pressure can also damage the blood vessels in your brain, which can lead to cognitive decline and dementia. Now that we know the possible causes and complications of hypertension, let's discuss some ways to prevent it. First is eat a healthy diet. Eating a diet high in sodium or saturated fat can contribute to hypertension. So it's important to limit your intake of these foods. Focus on consuming fruits, vegetables, whole grains, and lean proteins instead. These foods are rich in nutrients and fiber, which can help keep your blood pressure under control. Second is exercise regularly. Exercise can help lower blood pressure by keeping your body and heart healthy. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Third is maintain a healthy weight. Being overweight or obese can put extra strain on your heart and blood vessels, which can contribute to hypertension. Losing even a small amount of weight can make a big difference in your blood pressure. Fourth is limit alcohol consumption. Drinking too much alcohol can raise your blood pressure, so it's important to drink in moderation. For women, this means having no more than 1 drink per day. For men, it means having no more than 2 drinks per day. Fifth is quit smoking. Smoking damages your blood vessels, which can lead to hypertension. It also makes it harder for your heart to pump blood, which can worsen blood pressure. And sixth is manage stress. Stress can cause your blood pressure to spike, So it's important to find healthy ways to manage stress, such as yoga, deep breathing exercises, or spending time in nature. Next, let's discuss some tips to treat hypertension. First is monitor your blood pressure regularly. This is the best way to know if your blood pressure is under control. You can get a blood pressure monitor at most drugstores or online. Second is take medications as prescribed by your doctor. If lifestyle changes aren't enough to lower your blood pressure, your doctor may prescribe medication to help you manage the condition. It's important to take your medications exactly as prescribed by your doctor. Don't skip doses or take more than prescribed. Third is follow up with your doctor. See your doctor regularly to monitor your blood pressure and make any necessary adjustments to your treatment plan. Now let's address some common misconceptions about hypertension. First is only old people get hypertension. This is false. While it's true that blood pressure tends to rise as we age, hypertension can affect people of all ages. Second is hypertension can be cured with lifestyle changes. This is also false. Currently, there is no cure for hypertension. However, lifestyle changes can help manage the condition and lower your risk of complications. Third is all blood pressure is bad. This is false. There is such a thing as normal blood pressure, which is considered to be less than 120 over 80 millimeters of mercury. Blood pressure can also vary throughout the day and during different activities. For example, it's normal for blood pressure to rise during exercise. Finally, hypertension is always caused by something you can control. This is false. In some cases, hypertension can be caused by factors outside of your control, such as genetics or chronic medical conditions. Here are some quick facts about hypertension. Number 1. More than 1 billion people worldwide have hypertension. It's one of the most common chronic conditions in the world. As the silent killer, because it can cause damage without any noticeable symptoms? No. 3 people with hypertension are at increased risk of other chronic conditions, such as heart disease, stroke, and kidney disease. And no for World Health Day is celebrated on April every year to raise awareness of hypertension and other chronic conditions. We hope that you found this video informative and helpful. If you have any questions or comments, please feel free to leave them below. And if you like this video, please give us a thumbs up and subscribe to our channel for more informative content. Thanks for watching.